Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and today we are going to talk about, there's no other way to describe it, the mental health carnage that has resulted from COVID-19. This shouldn't come as a big surprise. Many of us have been saying this from day one, that our response to COVID has been far, far more devastating and damaging than COVID ever will be on its worst day. So this was a study done, published in Morbidity and Mortality Weekly report, basically done by the CDC, and they asked some almost 5,500, so it's 5,470 adults, if what they had experienced in the past several months as a result of this. I looking at the numbers are just not a surprise, but they're still scary to see it on paper and actually quantified. Of this group, 25% had experienced trauma or stressor-related disorder. So this is similar to PTSD. So don't quote me on that, but there's acute related and then post-traumatic stress disorder, PTSD. So basically, these people were had serious mental health damage as a result of that. That's a quarter of the people asked. Another 31% had experienced anxiety or depressive symptoms as a result of that. 13% of these, so what's 13% of 500? 650, 700 people were using substances to adapt or relate or deal with this. This is either new substance abuse or increased substance abuse. That is going to have a massive impact down the line on resources, deaths, and everything we've been fighting against in opioid use disorders these past couple years. Just massive ground being lost as a result of that. The other problem with that is these mental health therapists, psychiatrists are overburdened now. It's hard to get appointments. I know there's some clinics that have them, that have appointments, but we have the greatest need ever, and we still have a certain shortage of providers that can help people with these problems. So even if we recognize this and say we need help, the help isn't there because so many of these providers are already overburdened and doing everything that they can. Probably the scariest numbers out of all these was 11% of the group had seriously considered suicide in the past few months. That's significant, and these numbers, they looked at almost 5,500, but if we look at that, the population of the United States, and we extract that out, we're looking at 32, what do we got, 320, 32, forgive my math, even if it was 10%, we're looking at about 32 million people in the United States considering suicide as a result of not COVID, but our response to COVID, the fear that everything that's been driven into our brains and our heads, and the misinformation and the title reading and not actually reading the studies over and over and over again without any real logical look at what's going on in our responses to that. The other thing I found very interesting with this study was the huge disconnect with the younger population. So in adults 18 to 24, who arguably are at very low risk from COVID. I've seen other surveys where there's just society, there's the reality and then there's the perception. And the perception of what's going on and the amount of deaths and hospitalizations and people infected is off by magnitudes. And that disparity, that misunderstanding between reality and perception is very high in our young adults. And we see that here. So in the 18 to 24 year old group, they that suicidal ideation was 26% of them. That led to, when they compared the 18 to 24 group to basically middle age, like 45 to 64 years of age. So these two groups, these kids essentially who are at very low risk of harms from COVID versus the group that's getting to be at greater potential for harm, 666% higher thoughts of suicide in that younger age group versus the adult group. And then we talk about PTSD and the emotional harms starting our life when these people are supposed to be expanding, and it can't really describe enough how scary and dangerous this aspect of our response has been. And there's this part of people saying, oh, well, this is just, we just have to do this. We just have to get over this. Whatever the parameter is this week, we just need to get over this and we'll get past it. These damages, this way of life that people have been under for 6 months now is just almost irreparably damaging. These people, anybody with PTSD needs therapy to overcome everything that's happened, and this is going to be no different. We've got an entire age group of kids who were not affected by the virus, not from a health standpoint, not affected by the virus, but from a perception and emotional standpoint are just devastated as an age group. And this is going to be our society over the next couple of years. Those 18 to 24-year-olds are the ones who's going to set the tone for the economy and everything else going forward. So as always, I will post a link to the Morbidity and Mortality Weekly Report in the comments section. Make sure you share this video with somebody you think needs this information, like this video, and subscribe to the channel.